Hi everyone, my name is Dr. Linda Lay and welcome to CV Sorority, Sisterhood in Surgery. This is very exciting. We're doing a webcast / podcast about vascular surgeons that are women. And so we're just gonna dive straight in today. So as y'all can clearly see, I'm pregnant. I'm 29 weeks today. And so we thought this would be a great topic to start off because nobody really talks about this. There's again, a very different ratio of men versus women in vascular surgery. We are getting better about that, but it's still uneven. So today we have Dr. Palma Shaw, who's the program director in SUNY in Syracuse, New York. Welcome, who's my co-host for this entire series, and our guest, Dr. Cassidy Duran, who is with Vascular and Associates in Dallas, who also trained with me when I first started here and actually was pregnant with her second child at the time. And so both women have lots of experience with being pregnant and having children. So welcome, y'all.
Thanks for having us.
Thanks a lot.
One of the things that came first for me was, when I discovered that I was pregnant, we took 3 pregnancy tests. We didn't think it was for real, but it was very much for real. It became positive right away. There was no 3 minutes of waiting. The topic would be, when do you tell work? And how do you tell work, especially with our field where, I would say half of my cases are endovascular. You worry about, your radiation exposure, your fetal radiation exposure. And sometimes, we have to tell work early, sometimes even before family. And what are y'all's thoughts on that?
Linda, I would say this and looking over all of the kind of topics we considered discussing today, I'd say the first thing is pregnancy is so individual, right? We all have kind of a different experience. And so there are some rules to live by, but I would say number one is do what's right for you. And kind of, you have to learn to trust yourself first in pregnancy. And then as motherhood goes along, doing what's right for you and your circumstance is just kind of a rule to live by and keep some sort of your sanity. Particularly speaking to this question, I had to tell work, I believe I was 5 weeks pregnant. Initially, I was pregnant with twins and I wound up losing one of those. But I had extreme morning sickness. This was with my second child, actually. And I had extreme morning sickness early on. And I was doing a case alone and had to have the OR staff, call my staff back in because I needed to go throw up. And that was very uncharacteristic. I don't think I'd ever called anybody to come save me out of the operating room. So it just sort of forced the issue. Something was not right with me very clearly. And, I didn't really have a choice.
Right, yeah. And people notice right away when you normally don't step away from the C-arm and then all of a sudden you're stepping away and you're, having your resident do more. Palma, what was your experience and when did you tell work that you were pregnant?
So I found out I was pregnant right when I was finishing my fellowship and wasn't planned, and I was a single mother. As a result, I didn't want to tell work, particularly till after my boards. So I was trying to hide that and I was, working out like a fiend, trying to look as thin as possible, although it's a losing battle after a certain point in time, And so I got almost there before the OR nurses knocked me out and told my boss. So, I didn't have to make that decision. And it was kind of awkward. I was really scared. He was ultimately very nice about it. But in 2003, when this happened, I had no literature and nobody to talk to about this except the other female fellow graduating had just had a child. So I would ask her about what to do with the lead. And I was double letting near the end, kind of trying to, sneak that. And then when I got to my new job, I didn't double lead because I didn't want them to know until I was getting bigger, and then I would double lead. So, like Cassidy said, everybody's circumstance is different, and you don't know how much you're going to be supported or not supported. That's the thing.
Correct. Yes. Yeah. I mean, luckily for me, my partners were very supportive, and telling a certain amount of people. I mean, you obviously have to tell your radiation department so you can get a fetal badge, and then your partners so that they're aware of what's going on. But I mean, many times you do have to tell them before you tell your family and friends. So that was one of my concerns in the beginning of, in pregnancy, but, everything worked out well. Luckily that they were very nice about it, and my residents actually are very nice about it and will try to do as much of the DSA runs and do most of the work during endovascular cases. So symptoms. So moving on to that topic, so my various symptoms, I didn't even know, again, like I took 3 pregnancy tests, but all of a sudden I was more exhausted than I normally am. And, when they talk about pregnancy glow, it's more of like an oily grease. I broke out like I was 16 again. I mean, it was disgusting. And then of course the swelling. Luckily I wasn't that nauseated, just a little bit in the evening and a little bit in the morning, but if I ate something I would be okay. But what about y'all and what your symptoms were?
It wasn't too bad. I lived in my support stockings and every day. And I did have some nausea, and I would always keep like oyster crackers in my pocket. So if I just ate a little something, the nausea got better. But luckily, the fatigue was for real. The first trimester, you never thought you could be so tired. It's true. So.
Yeah, I'd say I had a similar experience in terms of fatigue. My 2 pregnancies were a little bit different. The first time I was a second-year resident in the ICU, and so I was nauseated, but I could always have a snack. And so I just had crackers nearby all the time, little ginger candies, all the little things. And so I kind of got through in that way. The second time around, I was back in clinical rotations, and I found that having a mask over my face was just awful. Every time I put a mask on, I wanted to throw up. I don't know the status on Zofran. I took Zofran every single day of my pregnancy until about week 30, just to get through. And when I didn't have it, I was sick. So that was a bit of a challenge. And I know for a while they were saying no Zofran, and I honestly don't know what the current status of that is. But again, I think it's just something you have to tell them and say, look, you're not doing yourself, and more importantly, the patient, any favors if all you can think about is throwing up. The exhaustion, I think that's kind of a universal, like Palma said, especially that first trimester. You get through the day, and I would limp through the door and fall down on the couch and not get up again till it was time to go again. You just sort of have to get through that mindset, I think, of you're going to be exhausted. And if you're fortunate by the second trimester, you're not going to feel so terrible and exhausted anymore. And then my energy level actually picked up pretty well, and I felt okay.
Yeah, I mean, the people that say they enjoy being pregnant, I'm not sure what they're feeling, but it definitely, for me, obviously I'm excited about having a baby, but the pregnancy itself, it's not that fun. You're just, more tired, and I have cankles like you could never imagine. In fact, my lymphedema patients now, I have so much more compassion for them. It's unreal. So, but yeah, the symptoms definitely improve by second trimester, but first trimester is pretty rough. And then, so what about maternity leave? What's a good amount to take off, and how do you navigate that whole process? I mean, I know there's, Cassidy, you're in private practice. Like, if that were to happen to you now, I mean, it's kind of, you eat what you kill. So if during that time you take off, are you making, are you getting paychecks? Are you making money? What is too short of a time? What is too long of a time? I find that difficult to navigate as well.
I would say, again, first of all, you can't let your decision be dictated by finances. We're all going to be financially okay. That just can't be the reason that you take 6 weeks or take 12 weeks or whatever you ultimately decide to do. That needs to be set aside, because in a very short period of time, that will be immaterial. It depends on your kid, right? And your situation. So I was between it was the last 2 weeks of my 6th year and the first 2 weeks of my 7th year that I took maternity leave. And that allowed me not to have to extend my training. So that's what I did. And it was a beating. It was hard. I had a C-section, but you just kind of do what you have to do. If I'd been out, I would have taken longer. I have a junior partner now who had a baby 6 months ago. She chose to take 6 weeks. I thought she was crazy. I'm like, stay home. She did it because she felt guilty you feel bad about your partners, right? She felt guilt about leaving her partners with extra work. Mom guilt is a real thing. It's a thing in work. It's a thing at home. It's a thing you have to learn how to balance. So again, kind of doing have to do. Sorry, I'm trying to turn off that messaging and I can't figure it out. Doing what you have to do to get through, but let your body heal if you can, because it's really. I know there were times when I was back at work and I was breastfeeding and working, resident hours and totally exhausted. And only seeing my child for the 2 a.m. feed days and days on end. If you can avoid doing that to yourself, you should, because it was awful.
And Palma?
So I had just started a new job, and I was able to take 4 weeks of maternity leave, and then I took 2 weeks off. I think 6 weeks was the least I would take on. I was okay. That was okay. And I was a single mother and I had no reserve financially, and I could barely pay my child care when I first got into practice. So I was unable to, really stay home and not get paid. So I did. And then was fortunate. My biggest concern was childcare. Like, who was going to watch my child when I was working these crazy hours, and ultimately found the daycare. And that's a discussion we can have, because I think everybody's situation for daycare and childcare is a big concern, and it's hard to pinpoint what exactly works for everybody. But I think 6 weeks was good. And it's never quite enough time with your child, but we do have a career that we have to pursue. I think it's a meeting midway. It's meeting midway and figuring out what you can do.
So I am so my plan is to take 3 months, which is definitely longer than 6 weeks. And I found, I've talked to, a few of my colleagues, and, obviously 6 weeks is the minimum. You do get more time off if you're doing FMLA or short-term disability. If you have a C-section, I think it's 1 to 2 weeks more. But that, 6 weeks, my OBGYN said it was too little. 6 months is very long, so there's some soft spot, maybe 10 to 12 weeks. I think it's all dependent on what, you feel comfortable with. But everybody has always said to me, take the time, because you will never get that time back again with your child, because once that's passed, it's passed and it's done. And nobody will really remember 1 or 2 years from now that, she took whatever time, 3 months off during her maternity leave. So, and especially, you know, like Cassie, you said, to take that time to recover yourself, because, you know, apparently birthing is quite an experience, you know, and recovery, which that'll be one of our topics in the future on one of our webcasts. But, you know, I don't know what your experience. I'm a little scared myself how that's going to go, but it doesn't sound like it's all you know, real easy peasy, I guess. Any thoughts on that?
Epidural all the way. When I was going to the ER, OBGYN, I know, I called her and I said, oh my God, what do I do? And she said, the first thing you do is you ask for anesthesia to put in an epidural, because they're going to go to lunch, and that 30 minutes that they're at lunch or dinner or whatever, that break will feel like it's endless. And of course I was on call that night. So my pager's going off as I'm in between contractions trying to actually answer my pager, because my partner, you know, was busy. So I was trying to like field text, you know, calls and deflect things and stuff like that. But the epidural is a good move in my mind.
That's crazy that you were still answering phone calls as you were having contractions. Cassie, what about you?
The 2 C-sections. I'd had previous major pelvic trauma in a car accident, and so round 1 had to have a C-section because we weren't sure everything would work out, having had bad pelvic fractures in the past. And then my OB said, oh, round 2 you're fine, you could be back, and that was the plan. And then I wound up having my water break and not going into labor. So, and I didn't even know it. I mean, that tells us how out of touch we are with our bodies. Is, you know, I was doing a case and I would run over and see her in between, and my OB pointed out that I'd gotten much smaller in the last week and put an ultrasound on, and all my amniotic fluid was gone. So she said, you know, you're having a baby today, go to L&D now.
Oh my gosh.
And so, you know, I've never been through the labor part. C-section hurts, but you get through it. You know, the reality as you get through it, and it all becomes a distant memory pretty quickly. I think we're probably tougher stock than average.
Yeah, I would definitely agree with that, with both of your stories. Yeah, so definitely for me, I'll do an epidural. My one of my best friends actually didn't plan on it, but had her baby naturally, and it just happened so fast they couldn't even get an epidural in, and she describes it as the worst pain of her life. So definitely epidural for me. And then, you know, I'm in my 3rd trimester now, and, you know, my partners and I have talked, you know, it's kind of reflective of how uncommon this is, but, you know, this is the first time we've had anybody go on maternity leave as staff here, and I'm sure that is seen often in other programs. But, you know, how do you decide when to stop taking call? How do you modify your call? How do you figure out, you know, when do you start seeing when do you stop seeing patients in clinic? When do you stop doing bigger cases like aortic cases? There's so many questions going on in my mind of like what is appropriate, and you know, how far do I push myself? You know, do I take it easy? What did you guys do?
I think the last 2 weeks, it's really hard to be in full speed. I would definitely rally, you know, go back and do minimal heavy cases, small cases, lighten clinics, because you don't know if you're going to deliver early, and then you can have all these patients kind of stocked up to be seen. So I definitely think the 38th, the 39th and 40th, like those last 2 weeks, I would plan that you may not be around, you know. And the second child I had fetal decelerations because they had actually increased my call in my 6th month. And so I was on call up all night doing like endo cases all night long and traumas. And then all of a sudden I went for a routine checkup and they said, you're having fetal decelerations, you're off call. So that pregnancy, I took myself off call. and just did, I got lots of rest, but did my day-to-day work. I did endo cases and E-bars and T-bars and stuff, but it was sort of like an 8 to 4 thing. And I just didn't take the call for about 4 weeks.
Wow.
Yes, I mean, obviously as a trainee, I was in a totally different position, and you and I've talked about this a little bit in the past. I was never the person in the room, right? There was always staff. So it didn't matter. I didn't have to limit myself. So I think it's important for trainees to get that message. Listen to your body. Don't abuse yourself. You also said something else a moment ago that stuck out to me. So you said, asking yourself, how hard can we push ourselves? And I had this conversation with another colleague of ours who just had a baby a couple weeks ago. And I said, this is the first thing you've done in your life that you can't work harder to be better at. Motherhood isn't that way. Like you can't work your way through it. You can't outwork this. It just is. So sometimes that thing that we all have inside of us that we're just going to push harder and push harder and push harder, you have to turn that off. It can backfire. And I too had, at 20 weeks with my first pregnancy, I started having contractions, taking a 36-hour call. And, you can very suddenly find yourself in a space where you go, okay, I'm endangering the life of somebody who didn't sign up for this. I need to get a little bit of perspective. And I think that's super important. And then, yeah, like I said, for the trainees, listen to your body, don't abuse yourself, but you don't really have to stop taking call, because the reality is when the time comes, the world, you're not going to be leaving patients in limbo and have a schedule that you can't fill, because you're not the name on the door, not yet. So there is some that I would say doing this as a resident, there is that benefit to it, that those stressors go away.
Yeah. So
I just want to mention, Linda, that I had my first child at age 37 and my second child at age 40. So that's like when we talk about when to time your pregnancy, I think a lot of us are having children later at older ages. And that's harder to be pregnant at 40 and have a child than when you're 30, physically.
Right. No, and I totally agree. I'm 37. And this is my first child. So we, like you and I are considered advanced maternal age, which basically just makes you feel really old because, unlike men who make sperm like fresh, new, like young sperm, we're born with our eggs, and as we get older, our eggs get old and crusty with us and not as good. And so that's another topic we will talk about in the future about, fertility issues and how to plan for that, the finances behind that, when to plan for that, because it's becoming more and more common. I mean, there's ads on Instagram like freeze your eggs, and that audience is to 20-something-year-old females. So it is an important topic to consider. But yeah, I mean, I definitely, thinking about how I was in my 20s, I think I would have done, much better being pregnant than now. I might have been one of those like skinny pregnant people, which I am not currently. But you know who I'm talking about. I think y'all were probably both skinny pregnant women, correct?
Not bad. No. Still working out.
I will say I had one at 30 and one at 35, and 35 felt different than 30. No doubt about it. And we sort of glossed over the third trimester. You feel tired and exhausted and pretty terrible first trimester. You get an energy boost second trimester. As you start edging into third trimester, everything gets hard. It's hard to put your compression stockings on. It's hard to stand at the table appropriately. You're operating sideways. Your back hurts. There's no space for you. It is a whole different. The end gets hard. It just is hard.
That's good. Yeah, I'm excited about that. I mean, I'm definitely starting to feel it. It's like harder to walk around, and you get a little short of breath, like short-winded, just going, doing rounds around the hospital and everything. But I mean, there's only one way. I mean, you just got to get through it. Everybody does. So, I'm looking forward to, delivering and not being so swollen. So any last minute comments before we wrap it up in terms of, being pregnant and symptoms and telling work, maternity leave, anything from you guys? Any thoughts to advice to give to those women listening out there and some men?
Just in the third trimester, I would say if you could adjust your schedule so you're doing cases you could sit, like AV fistulas, or if I was doing a fem pop, I was doing the popliteal anastomosis, I sat down. If you could strategize to sit as much as possible in the cases. At the third trimester, I found that very helpful.
So yeah, I had a high risk pregnancy OB because my second pregnancy there was one loss of one of the fetuses, and her very stern rule for me was you have to stop every 4 hours, break out of the case, go get some water, sit down for a minute, come back. There are limits to how hard you should allow yourself to push, and it's okay to say, I need to go get some water. I need to not get dehydrated right now. I need to take care of yourself. And, we have a really hard time doing that, and we'll continue to have a hard time doing it as mothers. You'll be at the end of a long list of things that need to be taken care of. But especially during that time when taking care of you is also taking care of your child, just give yourself permission to do it.
Yeah, definitely. I'm actually drinking my water now because I'm supposed to drink 2 liters a day, which I'm sure I've never drank that much water in the past before, but I'm trying my best to stay hydrated. Okay, well, thank you. Thanks, y'all, for taking the time out of your busy schedules. I know it was hard to coordinate, but I really appreciate y'all and the advice, and it really motivates me to see such strong women who have such strong careers, but also are moms, and are great moms at it, and make pregnancy sound like no big deal, that even though y'all have both been through so much. So I'm very lucky to have y'all as colleagues and friends in my life. I know I can always call y'all and ask you questions about what to do for both a hard case as well as this whole pregnancy deal. And actually Palma told me just the other day I need to go to 30 to 40 pressure for my compression stockings because 20 to 30 is not cutting it. So thank you for your time, and great talking to you.
Great.
All right.
All right.